Hey everyone, this is Carrie Anderson. Hope you're all doing well. In today's video, I'll talk about why is blood sugar checked at home. So if you like the video related to my health, my way, I would like to request you all please to subscribe the channel, hit the bell icon and give thumbs up so that I will come up with more and more videos with lots and lots of information. So here we begin. Let's go. Now the home blood sugar glucose testing is an important part of controlling blood sugar. One important goal of diabetes treatment is to keep the blood glucose level near the normal range of 70 to 120 mg before meals and under 140 mg at 2 hours after eating. Blood glucose level are usually tested before and after meals and at bedtime. The blood sugar level is typically determined by pricking a fingertip with lancing device and applying the blood to a glucose meter, which reads the value. There are many meters on the market, for example, Accu-Check Advantage, One Touch, Ultra, Sure Step, and Freestyle. Each meter has its own advantages and disadvantages. Some use less blood, some have a larger digital readout, some take a shorter time to give you result, etc. The test results are then used to help patient make adjustment in medication, diet, and physical activities. So there are some interesting development in blood glucose monitoring, including continuous glucose sensor. The new continuous glucose sensor system involves an implantable cannula placed just under the skin in the abdomen or in the arm. This cannula allows for frequent sampling for blood glucose level. Attached to this is a transmitter that sends the data to a page like device. This device has a visual screen that allows the wearer to see not only the current glucose reading but also the graphic trend. In some devices, the rate of change of blood sugar is also shown. There are alarms for low and high sugar levels. Certain model will alarm if the rate of change indicate the wearer is at risk for dropping or rising blood glucose too rapidly. One version is specifically designed to interface with their insulin pump. In most cases, the patient still must manually approve any insulin dose. The pump cannot blindly respond to the glucose information it receives. It can only give a calculated suggestion as to whether the wearer should give insulin and if so, how much. However, in 2019, the US FDA approved the first artificial pancreas type device, meaning an implanted sensor and pump combination that stop insulin delivery when glucose level reaches a certain low point. All of these devices need to be correlated to fingerstick measurement for a few hours before they can function independently. The devices can then provide reading for 3 to 5 days. Now, the diabetes experts feel that these blood glucose monitoring devices give patients a significant amount of independence to manage their disease process, and they are a great tool for education as well. It is also important to remember that these devices can be used intermittently with fingerstick measurement. For example, a well-controlled patient with diabetes can rely on fingerstick glucose check a few times a day and do well. If they become ill, if they decide to embark on a new exercise regime, if they change their diet and so on, they can use the sensor to supplement their fingerstick regime, providing more information on how they are responding to new lifestyle changes or stressor. This kind of system takes us one step closer to closing the loop and to the development of an artificial pancreas that senses insulin requirement based on glucose level and the body needs and release insulin accordingly, the ultimate goal. Then it comes to hemoglobin. To explain what hemoglobin A1C is, think in simple terms: sugar stick, and when it's around for a long time, it's harder to get it off. In the body, sugar sticks to, particularly to proteins. The red blood cell that circulate in the body live for about 3 months before they die off. When sugar stick to these hemoglobin protein in these cells, it is known as glycosylated hemoglobin or hemoglobin A1C. Measurement of HbA1c gives us an idea of how much sugar is present in the bloodstream for the preceding 3 months. In most lab, the normal range is 4% to 5.9%. In poorly controlled diabetes, it's 8.0% or above, and in well-controlled patient it's less than 7.0%. Optimal is 6.5. less than. So the benefit of measuring A1C is that it gives a more reasonable and stable view of what's happening over the course of 3 months, and the value does not vary as much as finger stick blood sugar measurement. So there is a direct correlation between A1C level and average blood sugar level as follows. While there are no guidelines to use A1C as a screening tool, it gives a physician a good idea that someone is diabetic if the value is elevated. Right now, it is used as a tool to determine blood sugar control in patients known to have diabetes. So that's all about the diabetes in this video. I hope you all liked it. And one thing more I need to mention, I personally prepared a small presentation for all of you guys that will be going to share in the description box below. You can check it out from there, and I'm 100% sure that will be going to help you in order to overcome the diabetes. So that's all. Before signing off, I would like to request you all, please do like, share, subscribe this video with the loved ones so that they can also gain their knowledge about this. So that's all. We'll definitely meet in the next video. Till then, God bless you all. Bye bye. Take care.